So there are several different types of breast cancer, and triple-negative breast cancer is a cancer cell that does not respond to estrogen, progesterone, or another growth signal called HER2. And these cancer types are more difficult to deal with in the breast. They're kind of the, quote, bad actor of breast cancers. So in the field of breast cancer, the particular cell type can predict a lot in terms of what can happen in terms of spread, in terms of pattern of spread, or response to treatment. And triple-negative breast cancer is problematic in that it does not respond to our typical anti-hormonal therapy. It responds only to chemotherapy, which is unfortunate for those that develop this type of breast cancer. And it tends to be more aggressive. It spreads a little more quickly. It has a different pattern of spread to different sites in the body. So when we deal with the breast cancer situation, those are the cancers that we are more focused on in terms of careful follow-up in the years after treatment. One of the things we've learned over the decades is that not all women benefit the same from chemotherapy for their breast cancer. And it turns out that it's the women that have the triple-negative type of breast cancer that often derive most of the benefit. So as the years have gone on with modern therapy, we tend to treat the triple-negative cancers with chemotherapy even when they're very small, whereas a regular estrogen receptor positive breast cancer we would not treat with chemotherapy if it was small and met other criteria. We are more frequently using chemotherapy as a first treatment for triple-negative breast cancer. And the reason is that good science shows that if the chemotherapy is effective and results in a complete response when the surgeon takes the tumor out, that those folks do the best. This is unlike most other breast cancer stories where we really don't do chemotherapy initially. There are a few special cases, and triple-negative breast cancer is one of those, where we will do chemotherapy first to make sure our treatments worked, and then proceed on with the surgical therapy and the radiation. So one of the things to realize about where we're at in state of the art with breast cancer is that the staging approach, which is a technique that the oncologists use to determine how bad the cancer is, where in the body has it spread, and we use our staging exercise to predict which therapies will work and to pick therapy. We've learned over time that triple-negative breast cancer, even though we stage it, is more aggressive stage for stage. And what this points out is that the biology of the tumor is very important. And what I mean by that is that it really is the genetic makeup of these tumors that predicts how things are going to go. And this is probably true of all solid organ tumors, and we're learning more every decade as time goes on. But in this particular situation, a very early stage triple-negative breast cancer can be a very lethal problem compared to a standard estrogen receptor positive breast cancer.